we are going to talk about sports injuries. Sports injuries may occur when a person engages into moderate to vigorous physical activity or MVPA. Moderate vigorous physical activity. This includes physical activities that span from moderate progressing to vigorous intensity. Breastwalking, cycling, and jogging are examples of moderate activities, while aerobic dance or cycling uphill are vigorous activities. On the other hand, sports injuries happen when you are playing sports or performing exercises. These are caused by poor training, practices, or wearing improper gear. Some people also get injured when they are not in a proper condition. No proper warm-up and stretching before you play or exercise can also lead you to injuries. The most common sports injuries are sprain, contusion or bruise, concussion, dislocation, fracture, strain. Let's start with a sprain. Sprain is a tear of ligament fibers, muscles, or tendons supporting a joint. This can occur when a joint is extended beyond its normal range of movement. A sprain may involve a small number of fibers through a complete rupture. In extreme circumstances, the ligament, muscles, or tendon fibers may remain intact and ripped from the bone. The second one is contusion or bruise. It is bleeding into the soft tissue which is caused by a direct blow from another person or an object. A bruise can occur to any soft tissue of the body. Concussion. This is caused by a direct blow to the head depending on the severity of the concussion injury. It can cause varying levels of impairment of the brain function. Concussions are categorized as mild or grade 1, moderate for grade 2, or severe or grade 3 depending on the symptoms. Next, we have dislocation. This occurs when a joint ball is forced off its socket. For example, arm forced out of the shoulder joint. Just remember that if a dislocation happens, it must be reset by proper medical professionals. Fracture is a break, crack, or shattering of the bone. In closed fractures, the broken bone does not pierce the skin, while in the open fractures, the broken bones break the skin's surface. Strains are injuries that involve stretching, partial tearing, or complete tearing of the tendon. Strains are categorized as a first, second, or third degree. Chronic strains are injuries that gradually build up from overuse or repetitive stress. After enumerating the common sports injuries, let us now move on and determine the kind of injury where they belong to. There are two kinds of injuries: acute and chronic injury. Acute injuries occur suddenly when playing or exercising. Sprained ankles, strained backs, and fractured hands are acute injuries. Signs of an acute injury include sudden severe pain, swelling, not being able to place weight on a leg, knee, ankle, or foot, an arm, elbow, wrist, hand, or finger that is very tender, not being able to move a joint as normal, extreme leg or arm weakness, a bone or joint that is visible out of place. The second one is chronic injuries. It happens after you play a sport or exercise for a long time. The signs of a chronic injury includes pain when you play, pain when you exercise, a dull ache when you rest, and even swelling. Exercise is good for the body, and with proper precautions, sports injuries may be prevented. The quality of protective equipment like padding, helmet, shoes, and mouth guards may contribute to sports safety, but you can still be susceptible to injury in certain situations. Some causes of sports injuries may include improper or poor training practices, wearing improper sporting gear, being in a poor health condition, improper warm-up or stretching practices before sporting event exercises. So how can I prevent sports injury? Developing a fitness plan that includes cardiovascular exercise, strength training, and flexibility may help decrease your chance of injury. Alternate exercising for different muscle groups should be done every other day. Cool down properly after exercise or sports. It should take 2 minutes as long as you warm up. Stay hydrated. Drink water to prevent dehydration, heat exhaustion, and heat stroke. Stretching exercises can improve the ability of muscles to contract and perform. It reduces the risk of injury. Each stretch should start slowly until you reach a point of muscle tension. Stretching should not be painful. It aims to hold each stretch for about 20 seconds. Use the right equipment or gear and wear shoes that provide support and may correct certain foot problems that can lead to injury. Learn the right techniques to play your sports. Rest when you're tired. Avoid exercise when you are tired or in pain. Always take your time during strength training and go through the full range of motion with each repetition. If you do sustain a sports injury, make sure you participate in an adequate rehabilitation before assuming strenuous activity. There are so many ways to prevent sports injuries, but always remember, prevention is better than cure. Now this time, I will assign age group to explain the cause of injury, identify the type of injury, and the basic treatment needed.